A stomach rumble, also known as a bowel sound, peristaltic sound, abdominal sound, bubble gut, or borgorygmus. It's a rumbling, growling, or gurgling noise or sound caused by the movement of a gas in the intestine. Raw bone tenderness is a medical sign that occurs when pain is the more intense after pressure on a tender area of the abdomen is suddenly released. It is a key indicator of peritonitis, which is an inflammation or infection of the peritoneum of the lining of abdominal cavity. This finding often suggests a more serious, potentially surgical condition like appendicitis or an abdominal abscess and indicates the need for prompt medical evaluation. Doctors talk about eructation, mastication, and melena, but what are they actually saying? It sounds like a foreign language, but it's mostly just fancy words for burping, chewing, and stool changes. Today we are translating the complex GI medical jargon into plain English so you can assess with confidence your patient. Confused about the difference between hematemesis and hemoptysis, struggling to remember what Kupffer cells actually do in the liver? Imagine finding blue discoloration around the patient's belly button. It is just a bruise or is colon sign worrying you of internal bleeding? From the ruga in your stomach to the villi in your intestine, the GI tract is a complex machine, but you can fix it if you cannot name it the parts. We are starting now our new series in gastrointestinal function by mastering the essential terms you need to know starting right now. In the world of GI assessment, vocabulary isn't just for exam, it's for patient safety. Welcome to part 1, Key Terms Explained. Chapter 55, Assessment of Gastrointestinal Function. First term, aneurysm. Localized dilatation of a blood vessel due to weakening of a vessel wall. Think as a balloon in a vessel. Next, anorexia. It's a loss of appetite. So anorexia, it's a key term that means no appetite, but the A here means like not. Ascites, it's accumulation of fluid in the peritoneal cavity. Ascites, it's sac of fluid. Bruitis, it's abnormal sound heard over an artery due to turbulent blood flow. Bruit is like whoosh, whoosh sound. Buccal, related to the cheek or mouth cavity. So buccal is the cheek. Cholecytokinin, it's a hormone that stimulates gallbladder contraction and pancreatic enzyme secretion. So CCK, it's a bile and enzyme mover. Chyme, partially digested food mixed with gastric juice. Chyme, it's like a stomach kind of soup. Constipation, infrequent or difficult bowel movements. It's the stool is stuck. Colon sign, I said earlier, bluish discoloration around the umbilicus indicating internal bleeding. Succulent, it's the belly button bruise, looks like. Deglutition, the act of swallowing. So it's like glub. Eructation, it's the belching, releasing gas from the stomach through the mouth. It's the burp. Goblet cells, mucus producing epithelial cell in the GI tract. It's like a cup of mucus. Hematemesis, it's a vomiting blood because hema, it's blood means, and here emesis, it's out. Or say vomit. I'm moving down slowly. Hematochezia, it's a passage of fresh blood via the anus. So hema, it's the blood. Chezia, it's the stool. Hemoptysis is a coughing up blood from the respiratory tract. So this can be, so hema, it's again blood, and then pitis, it's like the spit. Hemorrhoids, it's the swollen veins in the rectum or anus. So it's like varicose veins in the rectum. Hepatitis. Titis means inflammation. Hepa means liver. Hepatomegaly means liver and big. So it's enlargement of the liver. Hernia, protrusion of organ tissue through a weak spot in the muscle wall. So meaning hernia is pop out. Illus, temporary cessation of bowel motility. So ileus is the idle intestine. Intrinsic factor, protein secreted by the stomach, needed for vitamin B12 absorption. So intrinsic, it's inside, help for the vitamin 12. Jaundice, meaning it's yellow discoloration of skin and eye sclera from high bilirubin. So the jaundice is yellow. Kupffer cells, liver macrophages that remove debris and bacteria. So Kupffer meaning it's a liver cleaners. Mastication, the act of chewing. So it's mash food. Melena, it's a black tardy stool from digested blood. So it's melena, melanin, it's colored stool. Organomegaly, so it's an organ, and megaly means enlarged, big. Peritonitis, it is inflammation of peritoneum. Scrolling a little bit down. Rugae folds in stomach lining, allowing expansion. So it's the ridges. Secretin. It's a hormone that stimulates pancreatic bicarbonate secretion. So it's secretin, it's the secretes neutralizer. Somatostatin, it's a hormone that inhibits GI hormones and secretion. Somato means body, statin means to stop. Timpani, it's a drum-like sound from gas during percussion. Meaning a timpani is like a drum sound. Villi, it's a finger-like projection in the small intestine. Right here, in the small intestine, increasing absorption. So villi is the velvet fingers. Thank you for watching to the end, and that's the keywords for this part 1. And now we're gonna go into the outline of the chapter. Thank you, and see you in the summary.